I'm Melissa Hall, and on today's episode of the Care in the IE podcast, we're speaking with death doula Nina Bailey. Nina, how are you today?
I'm doing good, thank you.
Awesome. Thank you for being here.
Yeah, thank you for having me.
Yes. So, can you tell me a little bit about your career? What got you into the field of, being a death doula, which is just very non-traditional, right? It's like a specific field of work. And can you just tell me how it started for you?
Yeah, it's crazy because every time somebody asks me, I'm just like, I don't have a direct path to it. I
Mhm.
didn't expect to be a death doula at all. When I first started my career, I did a lot of family and child services. So I did social work. I was a case manager. I worked in criminal justice. Like my degrees are in psychology and criminal justice, and so that was what my focus was. I was like, I'm gonna like own a residential home and I'm going to take care of these kids and all these different ideas that I had.
Mhm.
And COVID came around and it changed everything because
Mhm.
the burden became too much. I was already in the field again for about 20 years. And when COVID came around, it was just like, I don't think that I have the bandwidth to handle like the challenges that are coming up anymore. Um, so I was trying to see what I wanted to do. I ended up switching actually to HR, which is what I do for my 9 to 5. And then during that time, I had a relative that passed abruptly,
Mhm.
not due to COVID, but it took us all by surprise. And in that time, I spent a lot of time with family. I was kind of like traveling back and forth. At that point, I was living in Austin, Texas. So I was traveling to Dallas where they lived. And I was staying there for like a week or so, or just like trying
Right.
to make sure they were okay, just giving some family support. And luckily, I'm very blessed to have like a family that's very like interactive with each other. And so they had lots of people to like take care of them and be with them.
Yeah.
But um, I got into yoga and meditation at first, and the death doula work just kind of came up spontaneously when I
Mhm.
moved to California, which was 2021. Yeah, 2021, I believe. We moved to no, 2022, sorry. We moved to
You're good.
California, and I was just like kind of looking up different stuff because I had already been looking up to be a birth doula. And
Yeah.
so I was looking up information, and like this scholarship came across from Going with Grace about, being a death doula, end of life. And I was like, oh, like I am very much interested in like afterlife. And I've always been a person that looked up like different deaths, like ceremonies, just things along that realm. And
Yeah.
so I just applied for it, forgot about it, and like a couple weeks later, they were like, "Oh, we're giving you this grant for it," and I'm really glad I applied. So I just kind of stumbled upon being a death doula.
Yeah.
Like that wasn't my first option.
Right. But it seems like you were always drawn to kind of service work. And I guess what inspired that? Or are you just naturally like a giving, generous person? Or how did that come about too?
Um, well, I come from two teachers.
Mm.
When my dad was in the military, he retired and then he became a special education teacher. My
Yeah.
mom has always been a teacher, and I do have a lot of people in my family who are educators. So,
Yeah.
working with children has always been a thing for me. And I think like just my own personal experiences is kind of just one of those things of like, the things that you felt you needed as a child, you want to give that to somebody else. So that's kind of how I got into the work of like child and family welfare. And then also just like the inequities of access to resources, especially
Right.
for people of color, like just wanting to be that support person. So that's how I pretty much got into like the work of wanting to help people get community resources like access to it, assisting with like crisis intervention, definitely being a mental health advocate. So, yeah.
That's amazing. Wow. And then, so how many years have you been a death doula now?
I would say it's been 4 years now. So I'm
Yeah.
still like navigating the space, but it's been really good.
Right. And then can you kind of share with me how your journey with that has been so far? How, like, what have you learned or what have you experienced within that?
Oh goodness. So becoming a death doula, like when I got into it, I was like, oh, this is gonna be amazing. I'm gonna learn so much stuff. I'm gonna be able to help people in a different kind of way. And
Hmm.
then the more I got into the studies, I realized like maybe I also got into it for myself because a lot of
Mm,
things started coming up. I think when people think of death doulas or end of life doulas, some people call themselves, is like you're thinking of just physical death, like
yeah.
funerals, helping families with planning, things like that. But I have come to a place of like, not only do I tap into that, but I'm also tapping into like childhood traumas, people losing their jobs, relationships endings. And I think for myself, I had to go back onto things that I thought I had kind of like healed from. And I was like, oh, I'm still like pretty pissed off about these things. And so
Yeah.
during that like program, it really helped me to kind of like open up some wounds that I thought I had worked through and just kind of like face them. So I went through my own kind of like grieving process again. So yeah, it's been an experience.
Yeah, it's like you're healing yourself while, helping others. So you kind of touched on people thinking a certain way of like an end of life doula or a death doula. What is it to you? What would you describe it as?
I think an end of life doula or a death doula, it's really helping people to own their emotions instead of running away from it, and also kind of looking at it from a standpoint of like this is going to be an ongoing thing, so helping people not only in the things that are ending but also like what's happening new for you in your life, like what type of transition are you going through after this ending happens. Like
Mhm.
maybe you were married for 20 years and your grief is this divorce, you've been with this person for so long, now you're having to start all brand new and figure out who you are again. So I feel like death doulas help a lot, not just in, the paperwork and the hospitals and things, like they're really walking you through your life journeys and being like that support person for you.
Yeah. And in your article with Black Voice News, you spoke about a 90, what was the age? 90 what? In
Uh,
their late 90s or early 90s? Um, Sorry, I'm looking at my questions. It says one says 92, one says 95. I don't know if it's different people, if it's supposed to be the same. Um, do you remember that story? Because if not, we don't have to touch on that. We could talk about
oh,
something
I
else.
will. I had a client in their 90s that was in hospice, if that's what it's
Mhm.
referring
I
to.
believe so, yeah. So
Okay.
your client that was in their 90s on
Yeah.
hospice care. Yeah.
Yeah, I worked with her in California, and I wish I could keep like we can't necessarily keep in contact. I was working with an agency.
Mm,
But yeah, I really enjoyed working with her. Like she would talk to me just about like all of her life transitions. So just learning about like her being a child and her own upbringing, the grief that she went through as far as like realizing certain things within her family lineage that she kind of
mm,
had to unlearn, and even just like because she has children that are still here. She had a daughter that would come and visit, and she has actually has a son that's here in Nevada too. But
mm.
she was just talking about their upbringing and just kind of like things that she wishes she would have done differently. And it was really amazing to talk to her because it was also like while we were having our visits and things, I could see her also still even at 90 something recognizing like her different little transitions she was having each day.
Yeah.
And so it was really nice to visit with her. She also was just very funny too.
Yeah.
She was on hospice when I first went to go visit her, and then
Mm,
it was like one day I went to go and she was like, I have horrible news, like I'm just so like sad about it. So I'm like, what's going on?
yeah.
And so they basically, her health was getting better during our visits, and she was like, they took me off of hospice and I just so it's very interesting like when you talk about death with people, because people feel like, oh, it's just like people are waiting to die and things like that.
Mm,
And she was just kind of like, she wasn't afraid of death or anything.
yeah.
She was like, I'm ready. I've lived a full life. Like, I'm ready to get up out of here. Now they're telling me I have longer to be here.
It's like she's not done yet. Yeah.
Yeah.
That that is it's interesting too because it seems like some people, I mean, I guess everybody's different, right? Some people might be fearful, some people might be ready.
Hmm.
How do you kind of help them through that or just kind of support them along that process?
I think that the most important thing is just being present. I honestly, when I visit some of my clients that I've had in hospice, they do most of the talking. I'm not
Mm,
gonna lie, like they do most of the talking. I do a lot of listening. I may ask follow-up questions to them, but honestly, they're just looking for people to come and like visit. A lot of people in hospice don't have too many visitors that come.
mm,
They may have some people do have some family members, but a lot of them they're kind of just there. They've created relationship within like the facility or the residence that they are living in. But what they're really looking for is for just like some companionship. So I would say presence is probably like the most important thing that I give to
yeah,
them. And I
yeah.
kind of let them work through whatever their thoughts are and whatever they're feeling. So yeah, it's really just like having an open ear.
No, for sure. And I guess even in your own life, I know you said you have a 9 to 5 too outside of that. How do you juggle like your own mental health around, these topics and trying to pour into other people? How do you pour into yourself?
Uh, um, it's not the easiest thing. I wouldn't say that I'm the best at it, especially with like where the world is right now. Like it's very hard, but I do get outside. Like I have people that I can go and hang out with. I do practice meditation, yoga, things like that. I try to follow like healthy eating habits and things like these little small things are very
Yeah.
helpful. Making sure that I'm getting sleep. I haven't been doing the best at sleep lately, but I try my best. Just like moving my body. Um, yeah, I just try to like take whatever little daily steps each day. Like I don't have this thought out plan because the weeks change. Like everything is just kind of like up in the air currently.
Yeah.
So I'm just like I'm trying to do the best that I can.
And that's all you can do. And
Yeah.
I'm sure you're doing great. So you also deal, like I know you said not just end of life, but also hospice care. A lot of that comes with, dealing with families who, do
hmm
show up and support and are really involved in caring. How can you support the families or loved ones as well within this experience?
Um, Having conversation with them, I just the family members that I have been in contact with, I just kind of like check to see where they're at. Like, how are you feeling today? Are any stressors or anything going on? Have you been hanging out with other people? Like, who's your community? Who's your village that you're able to reach out to? So making sure that I'm kind of like tapping in every now and then with them just to see like where they're at with things. Most of them I would see like they would come visit at hospice, and they would like let me know like, hey, I'm coming up there that day, maybe we can chat or whatever. So they're pretty vocal, and which helps a lot, and which lets me know like they do like the support that they give, even if it's just
Yeah,
like a 5 minute conversation. They really do appreciate it.
right. That's really good. And then even in these times where healthcare is like threatened, right? How do you navigate that, or how are your clients responding to that?
Oh, um, I know. Well, when I was in California, I definitely like I saw the bill of one of my clients, the lady that I was going to visit, and it was just the bills are very ridiculous
Mhm.
in the nursing home. I was very shocked at how much money is being spent, and everything is being counted as something that has to be paid for, down to if you wanted somebody to come and take your trash, there's a fee for that. If you
Wow.
needed a wheelchair, there's another fee for that. If you needed somebody to bring your medication each day, which most of them they do need medication,
Hmm.
and which was interesting because I felt like she was capable of like giving herself her own medication, but they made it to where somebody brings it, so there's a charge for somebody bringing your medication.
Wow.
And I think I don't know where nursing homes and like hospice care is going to end up currently because of the threat of Medicaid and Medicare being taken away, and there are some people already being stripped of that.
Hmm.
But I've been very nervous about it because I'm trying to figure out like where are these people going to go? Um,
Right.
Yeah, it's very scary right now.
It's very terrifying. And I think even for people who can't afford, hospice care or, any other caregivers and they have to be caregivers to their family themselves, do you have any advice for them or anything like that?
Um, I would say to look into community resources. I know it can be kind of tedious to try to look through that, but they are out there.
Hmm.
And making sure that you have some type of support system, where it's your family members or some friends, or if you know your neighbor down the street. Like, I know, I feel like here in the US, we can be very isolated with ourselves, and it is
Hmm.
hard to make community because humans are very complex people, but we do need each other a lot. And especially when you are being a caretaker and you have these things going on, it's very important to like try to find two or three people that you know, hey, I can rely on this person if something happens. I
Hmm.
know, like my parents, for example, my family has been very blessed to have blood relatives and even friends who we consider family, where they took care of both sides of grandparents in their home, and they did in home hospice. But if they needed a break or something, they could call their friend up to say, hey, can you just come, like check on them? Or
Right,
if they were going to be gone for a period of time, either myself or another family member could go out there and take over so that they could have like that time for themselves and like to rest. So
right.
yeah.
It's very important. And so in your field of work, what is, or I'm trying to think of maybe an experience that you've had that you're comfortable sharing that maybe touched you or just taught you something, no matter what that is.
Um, I would say honestly, it was the death of my cousin that passed during
Mm,
COVID.
yeah.
Well, he was a cousin. I'm sorry. He was a cousin by marriage, and so um when he passed away again, like it was very devastating because he wasn't very old, like there were some health complications, but it wasn't anything that was too serious like that. So when it happened, it was just like, oh my gosh. But I think watching um my cousin who he married go through that grieving process, and also watching her children, and it's they're still going through the process, but they're definitely in a much better place. But just
Mhm.
watching like the life transformations, and when it first happened, just watching her have to go through like the bills and the insurance, and then the things with his job, because again it was an unexpected death, and having to handle funeral arrangements and all the things. And I'm glad that we as a family were able to come together, because it can be very hard to navigate grief, and you also have to handle logistics. Like, is everything is like a whirlwind. So
Yeah, yeah,
I think that had the biggest impact on me, just watching like the navigating between mental health and navigating between finances, and just having a different life now that this person that you spent majority of your life with is no longer here, and having to recreate what life looks like for you. So
mm,
yeah, that was the the biggest factor, also in just me becoming a death doula too. Like
right.
it was very beautiful transformation, but also very painful. So
Mm,
yeah.
yeah, definitely a wonderful like catalyst into that career for you for sure.
Yeah.
Um, I'm trying to think what in terms of the beautiful aspect of this process, can you touch on that for me, please?
Um, yeah, I think the beautiful part of it is understanding that while death has occurred, like we're still here.
Mm,
So, how are we going to move forward? Like, are we going to continue to stay in this place of, um, I don't know, like isolation or sadness and things? And not to say that sadness won't come up at different, could come up years later again. You
right.
still have those moments. But it's also like, what type of life do I want to live? Like, when you have death close to you, things just start looking differently. It's like, oh, like this could happen tomorrow or this could happen 5 minutes from now. And it's
Hmm.
like, why am I spending time focused on small things? And I'm at the point where I'm just kind of, majority of things are really, they're not a big deal. They just
Yeah.
aren't. And I know we have our days where things are just irritating, like
Hmm.
especially now, it's very easy to kind of be irritated and frustrated. And it's like, I
Right.
don't know what's going to happen next, but at the same time, we've never known what was going to happen next.
That's true. That is very true.
Yeah.
Yeah. Yeah. And
So it's
definitely with,
just like
yeah, go ahead.
we can live or we can continue to like be afraid of what's going to happen. And
Hmm.
while I'm here, I might as well do the living. If my eyes opened up today, then I might as well take advantage of this day. So
Yeah. That's beautiful. Yeah, I feel like when you see it around you, you don't think it can happen to you until, it gets close, like a loved one, and then you're feeling,
hmm
definitely changes your perspective on life for sure.
yeah.
And not taking things for granted, or, like even like you said, like where you can be irritated over small things, and then when we realize that it could be so much bigger. Um, how do you support the family after their loved one has passed?
It all depends on what is needed.
Mm-hmm.
I know in the beginning when somebody first passes, like, you're gonna have the people coming over. A lot of people want to bring food and they want to, support you in any way possible, which can be pretty overwhelming also for
Mm-hmm.
people. So as a death doula, you can do things like maybe I'm collecting the food for you for this day.
Okay.
Maybe you want to be in your bedroom, you do not want to talk to people, and so I can be there, if people are coming by, let me grab that for you and I'll put it up. Let me straighten up for you. Don't worry about it. Like when
Mhm.
you're in your time of grief, you shouldn't have to worry about all these small things. A death doula can handle that for you.
Right.
Um, if you just need to sit and vent, whatever feelings you're having, again, just a listening ear. I don't even have to say anything.
Mhm.
I'm just there. Or if you want to take a walk or something, whatever it is that that person needs at the time, as long as it's not, anything that's going to harm themselves or anybody else, um, let's try it out. I
Right.
don't, everybody has something different that works for them. There's no linear way for people to grieve. So
So I think my next question for you is just like, what is maybe your favorite part about your job? What's something you really enjoy?
I like learning about other people. I'm all like, uh, I feel like I'm pretty nosy when it comes to like people's lives.
Right.
But in like I just want to like I'm into human behavior. So again, I went to school for
Hmm.
psychology. So I'm always very interested in like how do you live or how are you thinking about this when it comes to life? And so
Right.
I love learning about people's histories, like what religions or traditions they have within their own families. Um, yeah, I lost my train of thought just now.
No,
Can you
you're
ask the
good.
question one more time so I can?
Just like your favorite or most enjoyable
Oh,
part of your
yeah,
job.
I think yeah, spending time with the family, I do enjoy that. Um, just hearing the stories. I like it when people like go back to like memories that they
Hmm.
have of people or themselves. Especially when I work with the clients in hospice. Like I've worked with a woman and she was very close to like kind of having her last days. Most of the time when I would come, she was sleeping.
Mm.
And that's how I can kind of tell a little bit like, okay, we're coming to that point. There's more sleeping, less eating. She would maybe open her eyes for 2 minutes or so, and then I would just kind of sit there with her. But she, the day that she was able to like talk to me for a long period of time, I ended up finding out like she was a activist pastor in Chicago,
Wow.
and and
Yeah.
she just like lived this really incredible life. And so then when she moved to California, the area that she was in, it was kind of like down the street from where I lived, but it
Mhm.
was a hospice center and a nursing home, but also it was kind of like a small community for people after a certain age. So when you drove through there, there. There were like houses that people had, and then they had the center there. So she had like this little community. She didn't have any children or anything. She had never been married. And so I was asking her, like, so, on your last days, and do you have people coming to visit you? So she had people in the community coming to visit her. And I just thought that was really beautiful. Like
Yeah.
she really had an interesting story. And so I really enjoy, like, you never know who you're coming in contact with. Like the
Right.
stories that people have is like pretty amazing.
Yeah, and everyone is so impactful in their own ways and like in their own community. So it's really a beautiful thing when
Hmm.
people show up and come together for them as well.
Yeah.
Um, Even with just being a death doula, how has that had like how have you navigated your life within like like your family, your partner, your friends? Do you feel like you've looked at things differently, or maybe tried to even encourage them to like set up something for as they like get closer to their end of life, or
Yeah. Luckily, my family is like they're pretty on top of things. Like especially my parents,
that's
like
good.
very organized, like
Hmm.
people communicate with each other. But yeah, we have open conversations, so I appreciate that within my family. When it comes to my friends and things, a lot of them have children now, and so I'm always the person like, do y'all have life insurance? At least have life insurance. Like that's my thing for everybody. At least have life insurance. At least write something down that you would like. Um,
Hmm.
because I know it's still overwhelming for people to talk about planning for death. And then, like, you
Right.
have those conversations with people, and they're like, you trying to put me in the grave early, and like all those different sayings. I'm like,
Yeah.
I'm really not. I want you to have a good death. I want you to have a peaceful death. And I want the
Mhm.
people around you that are going to be left here to be able to grieve and not have to shuffle through a lot of things or argue back and forth because you have not left any type of instruction or anything.
Yeah.
Especially to my friends that have kids, you
Mhm.
need life insurance.
Very important.
Please,
And
at least top thing, everybody, number one, get life insurance. It's like
yes.
10, $11. It doesn't cost that much. You're not going to miss it from your bank account. I promise. If you
Well,
buy iced coffees and things, you're not going to miss the life insurance when it comes out either.
yeah. Yeah, exactly. Yeah. And then so as we wrap this conversation up, what do you like what advice or even resources could you offer to people that are maybe have a loved one in hospice care right now?
Compassion Care, they have a lot of information. As far as resources, Sage is another one. It's for like, I think like the senior citizens. So if you're like 65 up, I believe. And they have a lot of programming, which is really good.
Mhm.
I went through Going with Grace, but they do have a doula directory. Um, Oh, there's another one. There's Nelda, and then I think there's also NADA, which is a National Doula Association. And so they
Okay.
have directories also if you need doula care, and they have it like listed from state to state. And then also just kind of like getting more active in your community. You'll be surprised at like how many death doulas are around.
Right.
And I know it's still like a thing where people are like, what is a death doula? But they're around and they're very helpful and
Mhm.
they come from a more holistic standpoint. They don't do medical care or anything, but they are a very good person to have for advocacy and, just helping you with daily needs or emotional support. Um, yeah. And what was the
Yeah.
second part of the question outside of
No, you're
resources?
good.
Sorry.
You're good. You answered it all. That's perfect.
Okay.
Yeah. Thank you so much, Nina, for being here and for sharing your story and the importance of death doulas, and just you've just been a light. So thank you so much. It's been so great to meet you and speak with you.
Yeah, thank you for having me. I feel very blessed to be a part of this podcast. I appreciate it.
Yay. Thank you.
Hello and welcome back to BVN's Care in the IE podcast. My name is Alyssa Hall, and today I'm here with Dr. Wessam Labib, who specializes in family and geriatric medicine at Loma University Health. Hi, Dr. Labib. How are you today?
Hi, Wessam. How are you?
Good, good. Thank you for being here.
No, it's my pleasure.
Yeah, so kind of to get into your background, how long have you been with Loma Linda University?
So I actually started in Loma Linda as my first job after fellowship.
Wow.
So that started in 2009. So I finished my fellowship at UCLA for geriatric medicine.
Nice.
And Loma Linda was my first job as a geriatrician.
Wow. And so what inspired you to get into this field of work?
Well, complicated probably answer, but it started in my second year of residency. You start noticing how your geriatric patients are just needing more extra care. And also as primary care providers, you learn a lot of things, but there's not a huge focus on the geriatric piece itself, just in your normal primary care residency. So I felt that I needed to get more kind of education in geriatrics. Compassion to the geriatric patients. They suffer through a lot of things in mental, physical, and I wanted to really be specialized in that.
Right. So dealing with this field of work, you come across a lot of patients that I'm sure their family members are there or they have loved ones that are concerned about them. How do you go about trying to support them during this time?
So geriatrics, you can think of, you have a lot of healthy patients. So we live in the blue zone in Loma Linda, and it's the only in the nation. So you have a lot of healthy patients. I have.
Nice.
I remember specifically my 102 years old patient who is healthy and act like she is 60 years old.
Wow.
But also the common thing that you have more elderly patients, and some of them in the end of their life struggle, and they have terminal illnesses that they are dealing with, and that becomes a challenge. A lot of time the challenge becomes more to the caregiver even than the patient themselves.
Right.
Patients will have to suffer through dealing sometime with bad news, getting to understand what death will mean to them, and what kind of suffering or no suffering they will have to go through in the last week, month, or even a year. But caregivers carry a lot of burden of how they're going to support them in the last week, month, or a year. And there's a lot of time there's no great official education and classes or things that you can actually do to caregiver unless they actually seek that help. And that's the questions that we get in a lot of times in our specialty when the family members are dealing with that,
Right.
what to expect and how they're going to deal with that.
And what do you give, like what advice do you give for them on what to expect and how to deal with that?
Well, a lot of times expectations depend on knowing the patients themselves and the caregivers, right? So the beauty of geriatric medicine as a specialty that you can practice geriatric medicine in the primary care field, but you can also practice geriatrics as a specialist. I chose, since I started in Loma Linda, to have a primary care part of geriatrics, plus the specialty in two different clinics.
Okay.
And in the primary care, one of the advantages you get that you start learning the dynamics of the families, how families dealing with bad news or good news, and you have to modify as a provider your talk and your advice to your patients and their family members to what dynamic the family went through. You end up knowing their history, being here in Loma Linda for 17 years. I actually have patients that I started with in Loma Linda.
Wow.
So you known those patients for 17 years and they became part of your family. So there's no one unique advice that works for everyone, but there's some that's common to everyone. Back, I will rephrase that. So knowing your patients helps you as a provider to modify and adapt your advice according to their needs. But there's common things that works for everyone. Caregivers need to know that patient suffering can be mental, can be physical, and during the time that they're dealing with their loved one physical needs, they need to also remember the mental needs. Meaning, if my loved one is dealing with pain from any kind of illness, remember that pain is part of their physical concerns, but the mental health of being anxious and feeling alone or isolation or fear from what's going to happen tomorrow, it's something to not ignore.
Yeah.
And caregivers also need to remember that our loved one will look at them to get the energy. So if the caregiver is more positive in their approach, trying to help them psychologically to support their needs, they take the energy, and it means a lot for the patients.
Right.
If the caregiver looks burned out and they don't have enough support, our patients feel that. And sometimes that even start a guilt sensation from the patients when they're feeling they're putting so much load on their family members when they're sick. And that's part that you probably try to avoid as much as you can.
Right. And then in terms of care, there's palliative and hospice. What is the difference between those two?
So the best way to look at palliative and hospice, look at palliative as the bigger umbrella, and hospice is a piece of palliative. Palliative care can be done to any patient that dealing with a serious illness, regardless if the serious illness going to be a terminal condition or not. So when you're giving palliative care to patients, it doesn't mean that this patient will die anytime soon or their life coming to the end. But you're giving them physical and emotional support through a serious illness that they're dealing with. So that can be pain management, can be depression treatment, can be anxiety treatment, can be psychotherapy, and that's what palliative care is. Now, if the patient is in end-of-life care, where condition they have is very terminal, where you're not going to be surprised if that patient is not with us in 6 months from now it becomes hospice. So consider hospice as a type of palliative care. So not every palliative care is hospice, but every hospice is palliative care.
Oh, okay. And then, so not everybody chooses to do hospice, correct? What, especially in this kind of time where, it's not always affordable, what can families do to kind of support their loved one at their end of life?
That's actually a great question. So let's talk about most of our patients. Most of our geriatric patients will be under Medicare.
Okay.
Hospice is actually covered under Part A Medicare, so which is the type, so it's fully covered by Medicare from A to Z. So it's actually part of the benefits of our Medicare patients. So don't be afraid to ask for it because it's covered, it's part of your benefits.
Just how can family and, their loved ones better take care of them if they're not doing hospice or...
Right. So probably the first part also of your question, not every patient and every family member choose hospice.
Yeah.
And that comes to the fact that a lot of time there is kind of a stereotype kind of ideas about hospice, that it will be the last week of the patient's life or this is the last few days of patient's life. And it brings a lot of anxiety more and depression to the fact that patient on hospice, that mean they're not going to be with us too long. But that's probably not accurate. A lot of times we actually recommend that patient get on hospice a lot earlier than most patients do. Because hospice can provide a lot more than just pain management. They typically keep the patient in their most comfortable environment, if it's home, if it's their assisted living. But they also can give a lot of other support. They can bring a nurse that can come into the patient twice a week. They can treat any conditions happen at home instead of the patient having to run to the ER or go to even their primary care. They, by the way, still can see their primary care if they're hospice, but that's kind of optional more than that they have to in any way. So we always encourage patients and families to consider hospice early on. And we had seen it where you put patients on hospice and 6 months down the road, the patient's looking even better, and we graduate them from hospice because we thought initially this patient is not going to be with us more than 6 months, and the patient just energized from the amount of support you're getting, and patient actually live longer, and we found that this patient doesn't qualify for hospice anymore. So that's one thing. But otherwise, if the family decided not to go for hospice, it might be harder, but it's definitely possible. As long as you have enough family support where first you can take turns in caregivers. You don't want one caregiver taking care of the patient all the time. This caregiver is going to get burned out. They are not going to give everything they need to give to the patient.
Right.
You want to have a family schedule where everybody get a break, everybody can take time off so they can energize, can refuel, can come back with full energy. So that's definitely one very critical thing. A lot of times what I talked earlier about guilt, where patients feel guilty that they're putting so much load on their family members. The opposite also is very true. Family members feel guilty if they're not with their loved one every second. But you don't realize if you do that, they are taking so much energy out of themselves that they don't give 100% anymore. Right. And patients feel that. So get the time away, give some breaks, even if it's short breaks. It doesn't have to be days or two. It can be a couple of hours. but you're going to need somebody else to be present for that couple of hours. If you feel your loved one needs somebody with them 24 hours 7.
Right.
The other thing, if you don't have hospice care, keep close contact with the primary care. Even get connected to a palliative care provider, because if you don't want to go hospice, you still can do palliative, which is somebody that helps with pain management, somebody helps with any anxiety or depression that the patient is going through. They will give a lot of support to the caregivers too, either resources, classes. So those are things that probably should keep in mind.
Yeah. And what kind of resources and classes can the audience hear about that maybe they haven't heard of before?
So when it comes to the hospice, there is the National Palliative and Hospice Association.
Okay.
If you actually log into their website, you will find, or organization, sorry, I said association, it's organization. And you can probably, if you log into their website, you will find out a lot of resources that they can actually use. The other thing, there's what we call it elder care locator. So elder care locator is actually a government website that if you log into that, you'll have to put your zip code, and if you enter the zip code, will give you all of the elderly care available services in the area. So, for example, if you log in the zip code in San Bernardino County, it will show you the San Bernardino County resources for caregivers.
Right.
So let's say they're trying to help the loved one in their end of the life care, but they need some more extra support. That's where they can find that.
Nice. And earlier you just before you talked about how hospice can sometimes extend life just for, maybe being comfortable in your own home or being cared for by, your loved ones. Do you know, or could you speak to kind of like the mental health aspect within, this end of life or geriatric patients?
For the patient or the caregiver?
For the patient.
So none of us, I will tell you, spiritual care becomes critical end of life because it gives that internal strength where patients actually understand what life is and what's afterlife and so on. But also spiritual care, what we always believe that in Loma, spiritual care is not a specific religion. There is spiritual care. Spiritual care is slightly different than a religion because it doesn't, regardless of which your religion, you might have some spiritual beliefs that allows you to cope with the bad news and how to deal with it.
Right.
So that becomes a big part of that. But also, it's very underdiagnosed depression, especially after a terminal illness diagnosis.
Yeah.
So you'll find a lot of terminal illnesses, especially stroke, where depression becomes very common in stroke patients, but it's very underdiagnosed because a lot of times we are maybe blaming the strokes on some of the patient's behaviors of being quiet or doesn't want to talk or doesn't want to interact with the family members. But in fact, it might be depression. So having the provider, primary care provider or specialist treat depression, that might help a lot. The other thing, talking to family, having social interaction with the patient who is dealing with end of life care or end of life situation, having more social interaction with the family. I think that's what patients I found in my practice appreciate the most. A lot of patients choose that they want to spend their last week, month, or few months at home with their loved one rather than just being going in and out from the hospital. So all of that stuff form how mentally the patient will be ready for things that might be looked at as very scary.
Okay. And then, so you've been in this field of work for 17 years?
If you count the fellowship, probably closer to 20 with the residency.
What's a story that you could share with us that's maybe touched your heart or something that's maybe taught you something?
I don't think one story comes to my mind specifically,
Right.
but the common thing that you see so much in our practice that becomes something that you hear more frequently is that when the patients initially deal with end-of-life terminal illness news, a lot of what comes to their mind is what's going to happen tomorrow. And what I found that so many of them that start getting the right support and palliative or hospice or even just family medicine or family care supports, their mindset changes significantly. So it is very hard to tell patients once they hear bad news that they will feel better tomorrow. So I typically comfort them that there's always light in the end of the tunnel. But you have to wait and see. But they typically, once they understand all of the resources available, once they understand their illness more, once they find somebody to support them on a professional level and also at a personal level to deal with their fears, things start getting better. And that's what I see all the time in my patients, where initially the bad news becomes very devastating, and you can see the progression over the few weeks when they start seeing the support. They start seeing where's the options, where's the solutions, and how they're gonna manage their life after that kind of transition. Things gets better. And again, the opposite is true, where I see patients that don't get the right support, either from their family or from professional help, that things either continue to be very scary and very disturbing to them, or things even get worse. So let's always consider that there's always professional help for our loved one who are sick. And unfortunately, a lot of time, unless you seek it, you might not actually get that right help.
Yeah, and so it's like either having kind of like a growth mindset in the process, or maybe spiraling into, kind of that overwhelmingness of your diagnosis.
Absolutely.
Yeah, and then so as far as your own mindset, right, from working and like almost 20 years in this field, what have you maybe changed in your life, or with how you interact with your loved ones, just based on what you've seen and what you've the people that you've worked with?
That's probably a very good question. I think I always separated how my family life compared to my professional life. I think in my family life, I will be, again, the family member who has a loved one to take care of. It doesn't specifically, it's kind of two different hats, and you tell patients all the time, you understand what they're dealing with, and you try to put yourself in their shoes, but I am not with them 24 hours 7. I'm not with them at home, right? And that's the limitation of medicine. But for your family members, you're with them. So you see things that you don't see as a doctor. You see things that you don't see as a professional.
Yeah.
And that's what we try to teach our residents and fellows. We can say as much as we want that we understand what you're dealing with,
Right.
but we are not perfectly in their shoes unless we actually deal with something in our own family or our own health.
Yeah.
So that's why I think it's very different. I think when you deal with your own family as a family member, you're really immersed in every single minute, every single second they're going through, which again, from the professional side, you don't get that.
Right. And then as a family member taking care of, a loved one who's in this care, what would they see differently than a doctor would?
Oh, many things. I think our when I'm talking to any of my primary care patients who are dealing with a terminal illness and they have their family members with them, it becomes a more group interview. It doesn't become a more asking just my patient.
Right.
I even sometimes start the conversation by, are you okay with us talking about it as a family, as a collective interview, rather than just me asking the patient question, expecting the patient to answer it? Because the family members give you a lot different angles that you haven't noticed, or if you don't involve the family members in giving you the information, you miss significant part of what the patient deals with. So as a simple example, a lot of patients will have a lot of pride that they don't want to share with you how they feel. Either they don't want to share with you, some patients hide that they had a fall because they're embarrassed to say that they had a fall. But you want the family members to share that with you, because if you don't know about it, you're not going to be able to intervene.
Right.
So yeah, caregivers and family members see a significant amount of the information we want to know as professionals. So I definitely encourage always our caregivers to go with their family members, to go with their loved ones to their doctor's appointment, or at least be involved on the phone, so they can actually give their feedback, give them more information that maybe the patient themselves will not give.
Yeah. What do you think you've maybe heard in your work is the biggest concern that patients and their families have while in this process?
Well, I think it's always like what's happening next. So it's always like what's going to happen tomorrow, next week. The hardest one of it when you're really dealing with the end of life conversations, especially in the last 48 hours, 72 hours, because that's the fear that patients' family have. Can they handle having their loved one at home when they actually pass away? Can they be okay seeing them taking their last breath and be contained and in peace about it? And that's the hardest thing. So that's why you have to give them a lot of details and a lot of information what to expect. You don't want them to have any surprises. You don't want them to worry and get anxious and maybe even call 911, which we see it all the time, where a patient on hospice care, family have been prepared that this is might happen in the last 72 hours and or the next 72 hours, and because they're so fearful and they're haven't been told what to exactly expect minute by minute, they panic and they just call 911. And the issue with that, there's nothing wrong about that, except that maybe the patient didn't want that. Maybe the patient really wanted to pass away at home with their family members. They didn't really want to pass away in an ER bed and maybe even no family members around.
Right.
So that's why it's critical to address the patient's and the caregiver expectation day by day, if it's critical situation, or week by week. The other thing too that we always encourage, despite the bad access to find primary care providers appointments, for the end of life, probably more frequent visits, even if it's a video visit. So you can be up to date with what's happening with the patient.
Yeah. And so it's kind of hard to plan for death, right? And plan to lose a loved one. But what are some tips that you could give in terms of kind of trying to plan, around something so tragic, right?
You mentioned earlier stories of experiences that I had for the last 20 years. And the most encouraging is when you get a family member. So in primary care, you might end up seeing the daughter and the son, but you're also the physician, geriatrician for their father or their mother. So you end up dealing and meeting the family members after the loved one had passed away. And it's very encouraging when you see the smile on their face and say that they passed in peace and happy, because that's the most encouraging news, and that's what they keep in mind. And so if I have any tip to tell the caregivers, have the smile and have the positive attitude with your loved one, because that's what they're going to remember. But also that's what you're going to remember after they pass away, that you were able to give them the full energy with a very open-minded idea of what's going to happen next, but without showing them how anxious you are and how very obviously clear, sad and upset that you're going to lose them.
Right. Just being there for them.
Being there for them.
Yeah. And then I can imagine that being a geriatrician isn't like the easiest choice of work, but you've been in it so long. What's kept you,
Honestly, geriatrics is actually a very hard specialty. So geriatrics, you learn a lot of complicated illness. Your training goes from outpatient all the way to inpatient to ICU care to even skilled care facilities. But what kept me in geriatric field is actually the patients themselves. We always tell even our residents, the interest in geriatric field, going for a fellowship, that what is going to keep your energy is your patients themselves. I love all my patients, but every time you're going to an office visit, every patient give you a different reason of why you wanted to be a geriatrician. Either because they had very complicated illness and you know that you're equipped to try to help them with it, or because they had such a positive spirit about them, or because they actually pray for you, or stuff like that. So I feel our patients are definitely the main positive and the main core reason of why we stay in geriatric medicine.
Right. That's beautiful. Okay, Dr. Labib, as we wrap up this section of our podcast, could you share with us just any last thoughts or feelings that you would like to maybe let the audience know, or any caregivers that are dealing with this specific situation at this moment?
So end of life is never something that it's easy to talk about. it's not something that easy even for providers to talk about. So even for trained, well-experienced providers to try to give a bad news to patients, to tell them that they might be dealing with something that's very serious, it's not easy. So we completely understand that your loved one and you're trying to tell them anything that relates to bad news might not be the easiest thing to do. But know that with your care, with your presence around them, it is going to be a lot easier. So don't lose hope yourself. Give them all of the energy you have, spiritually, mentally, physically, and know that it will pay off. Know that you will make their last week, their last minute and second a lot more enjoyable than if you were not present.
That's amazing. Thank you so much for being here, and thanks for sharing all of your knowledge with us today.
I appreciate you guys having us.
Thank you.
Mm-hmm.